This is chapter 11, recording number 1. As an EMT, you have the ability to give medications as intervention for your patients, but you need to know how to do that seriously because it can have huge consequences for your patient. There are a few medications as EMTs that you can administer based on standing protocols. Otherwise, you can help patients self-administer their medications. You need to make sure that you know how to ask patients about medication use and allergies, and then report that information to the hospital. It's absolutely essential that you have the knowledge and skills to administer or assist the patient in taking their own medications. So some definitions. Pharmacology is the science of drugs. This includes their ingredients, the preparation, uses, and then how they actually act on the body. A medication is a substance that's used to treat or prevent a disease, and then they also relieve pain as well. Pharmacodynamics is the process by which the medication actually works on the body. There are several different types of receptors that are located throughout the body. This is the site on a cell where the medication actually binds and then produces some sort of effect. When medications are given, they bind to the sites and they either stimulate the receptor to produce an effect, or they block the receptor to prevent other chemicals or medications from binding at that same site. A medication can either increase or can decrease the normal function of the body. Kind of depends on what you're giving it for. So more terminology, the agonist is a medication that causes stimulation of the receptor. An antagonist is a medication that binds to a receptor and blocks other medications or chemicals from attaching to that same receptor. A dose is the amount of medication that is given. Typically depends on the patient's weight, the patient's age, or the desired action of that medication. Sometimes you have to give more in order to get the desired response. Action is the therapeutic effect that the medication is expected to have on the body. This is also referred to as the desired or intended effect. Indications are reasons or conditions for which a particular medication is given. Contraindications, situations in which a medication would either harm the patient or have no positive effect. And there are two different types of contraindications. There's absolute contraindications, and this is where the medication should never be given if this situation is present. Relative contraindications, you're going to end up weighing the benefit versus risk. If the benefits outweigh the risk, then you may decide to go ahead and administer that medication. And then side effects are any actions of the medication other than desired ones. There are unintended effects. These are undesirable but really don't hurt the patient in any way. And then there's untoward effects, and these are effects that can be actually harmful to the patient. Medication names can be pretty intricate. The generic name, it's simple, it's clear, it's non-proprietary. So generic names are not capitalized. An example would be ibuprofen. Ibuprofen is generic. Some medications, such as nitroglycerin, are called by their generic name more often than by their trade name. And their trade name is that brand name that the manufacturer gives to a drug. So Tylenol, which is actually the generic name is acetaminophen. Lasix is a trade name. The generic name is furosemide. The trade name always begins with a capital letter, and one drug may have more than one trade name because manufacturers often use the same medications. There are prescription drugs distributed by pharmacists, and they do require a physician's order in order to obtain them. Some of the over-the-counter drugs are purchased without a prescription. You have recreational drugs such as heroin and cocaine. Typically, these are going to be outlawed for the most part. Herbal remedies, using lemon and honey for a sore throat, and then just kind of your other vitamins, enhancement drugs, vitamin supplements. Any medication that a patient takes can be pharmacologically active and can cause an effect. So even though it's an herbal supplement or vitamins, we always want to ask them if they've taken anything. Most patients will just tell you about their prescription medications, but we want to know about all medications because any medication that you take can have an effect on the other medications that we may give in the field. Routes of administration. So there's a couple of different ways that medications get into the body, and how they actually truly enter the body is by absorption. So this is the process by which medications travel through the body's tissues to the bloodstream. Enteral medications enter the body through the digestive system. This is often in either pill or liquid form. And when you give medications through an enteral route, they tend to absorb relatively slowly. We don't commonly use them in the emergency situation because it does take so long for them to act on the body. Parenteral medications enter the body by some other means. It's often a liquid form administered through needles or syringes. This is definitely absorbed much more quickly. Often it is more predictable as to how it's actually going to respond, and you can actually measure the response. And here's a table that kind of shows you the subcategories of routes: enteral, sublingual, per rectum, or per mouth. Sublingual tends to be a little bit more rapid. It goes underneath of your tongue. This is where we put nitroglycerin. There's a pretty rich blood supply right underneath the tongue, so it does pretty good. Rectum, obviously, it goes into the rectum or the anus. And this also has a pretty good blood supply. If you swallow it, it has to go through your stomach and then into your intestine before it's actually absorbed. Parenteral, IV, IO, they're immediate actions. They go directly into the bloodstream. Inhalation, intranasal, so breathing it in or squirting it up the nose. Intramuscular, you're taking a needle and going directly into the muscle. That's moderate. It's not super fast, but it's not super slow. Subcutaneous, you're actually putting it into the fatty layer underneath the skin, and transcutaneous is on top of the skin. Those are definitely a lot slower. The form of a medication typically is going to dictate how you give it. So those that are tablets and capsules, those typically are going to be given orally for the most part, because you have to have a liquid form in order to give it through a needle. Solutions and suspensions typically are going to be swallowed as well. Solutions also can be injected. Meter dose inhalers are going to be inhaled. Topical medications and transcutaneous medications are going to be on top of the skin. Gels kind of depends, but a lot of them are going to be topical as well. And then gases for inhalation. Honestly, it's a little bit common sense. I mean, a tablet or a spray can't be given through a needle. The manufacturer is going to choose the form to ensure that it's given the proper route. They do a lot of studies to make sure they know when the medication is going to release into the bloodstream and then what effect it's going to have on the body. So tablets and capsules are given by mouth. Capsules are gelatin filled or gelatin shells, filled with either a powdered or a liquid medication. Tablets contain other materials that are mixed with the medication, and then they compress them down very, very tightly. A medication that is given orally, it must be swallowed and digested, so it provides a slower route, which we've already kind of talked about. Solutions is a liquid mixture of different substances that can't be separated by simple means. Solution can be given by several different routes. It can be given by mouth and can be actually absorbed fairly quickly because it's already dissolved. It doesn't have to dissolve a capsule or a tablet. But many solutions are given IV, IM, or sub-Q. A suspension is a mixture of finely ground particles, and they are put into some sort of liquid. They will distribute throughout that liquid, but they don't actually dissolve into it. So you actually have to shake or stir in order to make sure that the patient is going to get an adequate dose of the medications. Suspensions will separate if they stand or if they're filtered, so it's important to shake them up. These are usually administered by mouth. They're occasionally given rectally or applied directly to the skin, such as like calamine lotion for poison ivy. They can be given IM or sub-Q. Hormone shots are an example. Vaccinations tend to be a suspension as well. Metered dose inhalers, these are liquids or solids that are broken into small enough droplets or particles that you can actually go ahead and inhale them. It has a spray canister that directs substances through the mouth and into the lungs. And giving these does take a little bit of talent and attention to detail. Otherwise, they're just going to bring it into their mouth and it's not going to absorb the way that it wants to. A metered dose inhaler actually delivers the same amount of medication each time that it's used. These are often for respiratory illnesses, asthma, emphysema, albuterol kind of being the more common one that we think about. And every time you depress that little canister, it's going to squirt out the same amount of medication. Topical medications, these are lotions, creams, ointments. They're applied directly to the surface of the skin, and they affect only that area. So lotions are containing mostly water. They're absorbed rapidly. Ointments contain less water. They're absorbed very slowly, and they tend to be thicker. So some examples: calamine lotion for poison ivy, a cream, it's kind of in between a lotion and an ointment, hydrocortisone cream for itching, and then an ointment, pretty darn thick. It doesn't absorb really easily, so Neosporin would be an example of an ointment. Transcutaneous, this is designed to be absorbed through the skin. We also call these transdermal. Unlike topical medications, they don't just affect the site that they're placed at. They actually get absorbed into the body and into the bloodstream so that they have whole body effects, systemic effects. Examples are nitroglycerin paste, or it's medication that is put into a gel that goes onto the skin. You can have a nitroglycerin patch. You can have nicotine patches, pain medications, fentanyl patches are huge, and also some contraceptives. So birth control that is in a patch that you place on the skin. If you touch these patches or that nitroglycerin paste, you're going to get a dose of it just like your patient would. So if you have to remove one, make sure you have gloves on. And we'll stop there and go on in the next video.